Hi, I'm Annakan. I'm an ENT surgeon that works in London and I specialise in treating conditions affecting the nose. In this video, you'll find out what a nasal septoplasty is. So, let's start off with the structure of the nose and what the nasal septum is. In the middle of your nose, on the inside, you have a thin piece of cartilage and some bone called the septum. You can think of the cartilage like rubber. It is flexible but firm enough to retain its shape and therefore provides your nose with shape and structure. The septum is like a wall that separates the left and right sides of your nasal passages. Often the nasal septum is not perfectly straight and it can bend to one side or to both sides. This can be caused by an injury to the nose or simply due to the shape your nose has reached once it stopped growing. We call this a deviated nasal septum. Most people with a deviated nasal septum have no symptoms at all. However, depending on where the bend is in the septum, it can block air passing through the nose, making it difficult to breathe. It can also contribute to symptoms such as snoring. If there is no blockage and it's easy to breathe through the nose, even with a deviated septum, then nothing further is needed. But if you have difficulty breathing through your nose and you have a deviated nasal septum, a septoplasty may help change that and improve your ability to breathe through your nose. This operation can help remove the nasal blockage by straightening the nasal septum, and the aim of the surgery is to make it easier to breathe through your nose. This is a type of nasal surgery I commonly perform for patients in hospital. A septoplasty operation is usually undertaken under general anaesthetic. This means you'll be asleep during the operation. And this will be undertaken using medication and therefore you will not feel any pain. Typically in this operation I will make cuts inside the nose to perform the surgery, and these cuts aren't usually visible on the outside of the nose. In order to gain access to the cartilage of the nasal septum, after the cut is made, I will lift off a layer of tissue off the cartilage. This layer is called mucoperichondrium, and the mucoperichondrium is the lining on either side of the cartilage of the nasal septum. I will then perform surgical techniques to rearrange the structure of the nasal septum, to realign it and straighten it. This can be as simple as simply removing a bent piece of cartilage, or as complex as removing and rebuilding the entire nasal septum like a jigsaw puzzle. I will then place the mucoperichondrium back over the newly reconstructed nasal septum and place stitches through the septum to keep the mucoperichondrium in place. If you imagine the nasal septum is like a cheese sandwich with an uneven or bumpy slice of cheese inside. The cheese is the cartilage and the bread is the mucoperichondrium. During the operation, I have to lift the bread off the cheese without tearing the bread, and then remove and rearrange the parts of the cheese slices that are uneven or bumpy and replace the bread back down over the sandwich. I hope this has helped you understand what a nasal septoplasty operation is and why it can help patients with a deviated nasal septum breathe through their nose. Thank you for watching.